Hi, I'm Dr. Donald DeFabio, and it is a great day to talk cardiovascular fitness and heart health. We're ramping up for Valentine's Day, but the bottom line is cardiovascular disease is the #1 killer in America still. So whatever we can do to empower you to have a healthier cardiovascular profile, let's say, it's going to help reduce your risk for disease from the #1 killer in America. So there's lots of lifestyle things you can do to help your cardiovascular health. First thing we're going to talk about is blood pressure. Yes, we want to look at your blood pressure. It should be within a normal range, obviously. And there's 5 factors that control blood pressure: how hard your heart beats, how fast your heart beats, the diameter of your blood vessels, the thickness of your blood, and the volume of your blood. That's what controls blood pressure. From a chiropractic perspective, I get excited when I talk about this because 3 of those factors, how hard your heart beats, how fast your heart beats, and the diameter of your blood vessels, are directly related to muscular function. What controls muscles? The nerves. Where do the nerves come from? The spine. We balance the spine. It helps balance muscular function, and it helps to balance your blood pressure. That's why it's really, really important to take chiropractic adjustments to help maintain a normal blood pressure. And that's the relationship. Pretty straightforward. On top of that, there's lots of things you can do naturally to help with your blood pressure. One of the things is to help open up those blood vessels if your blood pressure is high, right? We want to vasodilate. We want to relax the muscles. How can you do that? Well, #1, cardiovascular exercise. That includes LSD. That's right, I'm telling you to do LSD. Long, slow, distance cardio. You have to exercise for 45 minutes or longer. It doesn't have to be really high, but it has to be long. Those long duration cardiovascular activities will help sustain blood flow and open up your blood vessels. The other great thing about long duration cardio is it helps build your HDL. However, short, higher intensity bursts of cardio, little HIT, high intensity intervals, or a run or a cardio half hour, your heart rate gets a little higher, that's excellent for raising your HDL, which is an anti-inflammatory cholesterol. It's a cholesterol that reduces your risk for heart disease, which we like. So those are 2 benefits of getting cardio in, and it needs to be on a regular basis. 120 minutes a week is what was currently recommended by the American Heart Association. So get out there, walk, run, cycle, get some cardio in. Now, we talked about HDL. What about LDL cholesterol, the low density cholesterol, the bad cholesterol? Well, it's not so much bad, it's just that it gets inflamed. And when it gets inflamed, it gets sticky. And when it gets sticky, it sticks to the blood vessels. And then you get hardening of the arteries. So we want to reduce that. How do we reduce that? Well, again, cardiovascular exercise helps. And we also want to look at supplements that reduce the low density lipoproteins, your LDLs. Red rice yeast, excellent natural supplement to help reduce those cholesterol levels. I always pair it with coenzyme Q10 because red rice yeast does interfere with the coenzyme Q10 pathway. So always pair these, stack them together. Excellent, natural, safe, will help reduce your cholesterol levels. A lot of times, depending on your fractions, depending on what percentage of HDL and LDL and large particle and small particle and EPO-A and EPO-B fractions you have, and those are all types of cholesterol. There's not just 2 types of cholesterol. A lot of times we'll recommend niacin. It helps vasodilate. And again, we talked about the importance of vasodilation. However, niacin will give you a flush. It will make you itchy, it will make you red. Take it with food, or better, get no flush niacin. Do you need niacin? Maybe, maybe not. It depends on your differential, your particle size of your total cholesterol. How do we figure that out? We order a test called a cholesterol with an NMR, Nancy Mary Robert profile. When I order that, it gives me all the different breakdowns of all the different particles. Are they big, fluffy particles, which we want? Are they small, tiny particles, which we don't want? Because tiny particles are going to be more sticky, more pro-inflammatory than the big, fluffy ones. So those are the things that are important to look at your cholesterol level. But while we're talking cholesterol, let's keep going. Only 15% of your ingested cholesterol is related to dietary cholesterol. That's right. So cholesterol isn't just from diet. Your liver makes cholesterol for your whole body. Every cell in your body makes cholesterol because the outside of the cell is high in cholesterol and PUFAs, polyunsaturated fatty acids. So your body's going to make it anyway. So in fact, oftentimes people aren't eating enough fat, and that's why their cholesterol level's high. So sometimes you got to eat more fat, but you eat good fats. Olive oil, coconut oil, fish oil, salmon, cod, eggs that are omega-3 eggs, omega-3 fatty acids. Those are all really good sources of fat, which may actually reduce your cholesterol. Again, work with your doc on this. There is no magic potion. There is no certain regime you follow. It's very, very individualized when it comes to cardiovascular health. Some lab tests, a solid history, monitoring blood pressure levels, those are all important. And what else is important is knowing the difference between your heart rate and your pulse rate. They're different. What do you mean? Yeah, your heart rate is related to the electrical contractions of your heart. Every time you get an electrical contraction, that's your heart rate. Pulse rate is what happens over here when that electrical contraction creates a wave of fluid. Now, what if this contraction is really strong? I get a really good strong wave of fluid in my pulse in my finger. If I get a weak contraction, it may not create a pulse. The heart could be working really hard, but it may not be creating a pulse. So pulse rate, heart rate are not necessarily the same. And when there is an imbalance between the two, that could be a serious issue. So if you really want to check your heart rate, you should be wearing a heart rate monitor across the chest that's picking up the electrical contractions of the heart. That's much more accurate than a pulse monitor at your wrist or your finger. So let's look at this from a 3,000-foot view. It's lifestyle. It's eating right. It's exercising. It's taking some supplements. And it's getting enough sleep. If you don't get sleep, you're not going to heal. A major important parameter of diet from the American Heart Association is the DASH diet, dietary alternatives to systolic hypertension. It means foods high in potassium. That's right. Yes, you can have orange juice, not one of my favorites. Yes, you can have bananas, also not one of my favorites. Or your biggest bang for your buck for getting potassium is low salt V8. That's right. A glass, 8 ounces of low salt V8 will give you 800 milligrams over a potassium. So you want to get a potassium shot, do that. You can also go with coconut water, very high in potassium water. That's why people like coconut water, because it's high in potassium. Most people need it. You also need magnesium. Magnesium comes from green leafy vegetables. Your magnesium levels are directly related, to your diet. Most of our foods are magnesium depleted. Magnesium is important in over 300 reactions in the body. So magnesium is important. How do you know if you need magnesium? You have your RBC magnesium, your red blood cell magnesium, checked, and the next time you have a blood test with your doc. RBC magnesium tells you what the concentration of magnesium is in your cells. That's how you know if you need magnesium. Potassium's always a good choice. So get enough sleep. It's got to be restful sleep. That's the topic of a whole nother video. And calm breathing. Calm abdominal breathing oxygenates your tissues, creates nitric oxide. We talked about that. Opens up the blood vessels and dilates them. And breathing through your nose will also create nitric oxide. So breathing low, slow through your nose is also good. You don't have to be a statistic from cardiovascular disease. If you eat right, exercise, take some supplements, get enough rest, and be proactive in your health, you increase your lifespan by approximately 8 years. That's how much it's going to help. We know that statistically. So the choice is yours. You can be a statistic for heart disease when you're younger, or you can crash and burn and hopefully not become a statistic from heart disease. but there are lots of things you can do to help reduce your risk. It's been a great day to talk cardiovascular health and nutrition for a healthy heart lifestyle. I'm Dr. Donald DeFabio. Thanks for tuning in. Please like, subscribe. We'll see you on the next show.